Dr. Jessi Gold is a psychiatrist who's a professor at Washington University in St. Louis and treats fellow doctors, nurses, hospital workers. Dr. Gold, when it comes to healthcare workers right now, we keep hearing these words over and over. Overwhelmed, exhausted, traumatized. How bad is it?
Bad. I mean, I think it's so different than March and April, and people don't realize that. I think in March and April, there was hope. There was this glimmer of, if people just stay inside, if people just follow this one little bit of time where they need to be inside and it'll end, maybe we'll be able to get through this and it'll be over, and I just have to work really hard for a month. And that doesn't exist anymore. It's very clear that people are tired and over it and don't want to wear masks. But at the same time, we are taking care of people who are really, really sick in bed after bed after bed. And we look and we say, our beds are almost full, or our ICUs are almost full, or we're almost out of ventilators. And that's the same story all across the country. And also in March and April, it wasn't. It was maybe condensed to the coasts or condensed to a few cities. And that's really different now. It's kind of all over the place. So we can't send replacement staff. We can't send replacement ventilators to these cities that are struggling when every city is struggling.
Dr. Gold, what are your patients who happen to be more accustomed to treating other patients telling you right now when you talk to them?
Yeah, I mean, I see healthcare workers from the people who greet people in the hospital, the people who clean the hospital, to like a person who's an administrator in the hospital, and everybody's really been struggling. I think there's not one person who's not having a hard time. I hear those words you're saying, exhausted. I hear sadness. I hear overwhelm. I hear anxiety. I hear people saying a lot, it didn't have to be this way, and I wish it wasn't this way. At the same time, we're doing our jobs, and we'll always do our jobs, and they'll show up and take care of people because they want to show up and take care of people, and they're caring human beings, and they'll always do that. But I think it's really hard to sort of balance the two and to keep balancing the two and wonder, how long do I have to do that?
This is a holiday week. It's a time to be thankful and really look around and see what we do have this year. It's a whole lot different in the past. I wonder, looking across the whole landscape, you mentioned back in March and February, some people saw a glimmer. Some people felt hope. What gives you a hope today, Dr. Gold?
I think I'm hopeful about the vaccine, for one. I'm also really hopeful when I see how much my friends and patients still care about people. I think no matter how worn down, sad, exhausted they are, they just want people to not get sick and not come to the hospital, and all they want to do is help people. And all that shows me is these people are great human beings and great people, and it just reiterates that over and over and over again to me, and I think that gives me hope. I see hope in the people that we trust with our lives.
And in this holiday season, all of us saying, oh, we're so thankful for healthcare workers, you know, for people who are even doing janitorial work in these hospitals. How can we show our gratitude?
Wear a mask, social distance, say Zoom Thanksgiving. I mean, all these things that feel really hard, you know, I know it's really hard not to do what you want to be doing, but you will save so many lives that way, and you will help so many healthcare workers that way. That's how you give thanks to us right now.
Dr. Jessi Gold, doing critical work in a critical field, especially right now. Thank you so much.
Thanks for having me.